Hi, I'm Cheryl Jackson. Welcome to Your Voice. Every child at some point throws tantrums and is defiant. It's a natural part of childhood, up until the age of 3 or 4, when most kids learn how to navigate their worlds without being consistently oppositional. But up to 15% of school-age children don't improve. They have what's called Oppositional Defiant disorder, or ODD. These kids throw frequent temper tantrums, they argue excessively with adults, blame others for their mistakes, and they say mean and hateful things when they're upset. About 10% of kids with ODD will go on to have more complex problems in adulthood, like antisocial personality disorder. Why do so many kids have oppositional defiant disorder? How can parents tell if their child is exhibiting a normal tantrum or symptoms of ODD? And what can be done to help these kids? I'm joined by two people who can provide some answers. Here in studio with me is Jordan Peterson. He's a clinical psychologist and professor of psychology at the University of Toronto. His areas of research include aggression in children and adults and motivations for social conflict. And joining us via webcam from South Portland, Maine, is Ross Green. He's the author of The Explosive Child, a new approach to understanding and parenting easily frustrated and chronically inflexible children. He's also associate clinical professor in the Department of Psychiatry at Harvard Medical School. Welcome, Jordan, here in studio. Welcome, Ross, on webcam.
Thank you.
Jordan, I'll start with you. Can you tell me what exactly is oppositional defiant disorder? How would you describe it?
I think it's a form of dominance display. I mean, human beings are social animals, and they're interested in climbing up dominance hierarchies, and children do that, which is partly why they test. And kids with oppositional defiant disorder are more dominant and more aggressive and often more emotional, and so they show increased rates of defiant behavior. They're testing limits more constantly, and they tend also to be more explosive in their anger, so it's harder for them to control it.
Okay. Ross, do you have anything to add to that? How would you describe it for parents?
Well, I view oppositional defiant disorder quite differently. I think that that trying to distinguish between a normal tantrum and an oppositional defiant disorder tantrum is, I'm not exactly sure how we would do that, but I'm not a very diagnostically oriented mental health professional. I think that what a diagnosis mostly tells you is that your kid is throwing tantrums more frequently and in ways that are more extreme than whatever the norm might be. But I view kids who are exhibiting such behaviors as lacking in crucial cognitive skills. I don't view this as an issue of dominance at all. I find that these kids are lacking skills in some very crucial domains, such as flexibility and adaptability, frustration tolerance, problem solving. And so it's a very different point of view. From one point of view, from my point of view, challenging behavior is the byproduct of lagging skills, not an attempt to be dominant.
Okay, Ross, we'll get back to you in a minute here, Jordan, but first of all, kids have obviously exhibited these behaviors forever, I would assume, but when did we start calling it ODD or talking about it this way, Ross?
Well, we started calling it ODD. We started recognizing it as an official diagnosis in the 1980s version of the diagnostic manual that we use. Before then, I'm not exactly sure what we were calling these kids. Once again, all a diagnosis really tells you is that a kid is at an extreme end of the spectrum in terms of the frequency and severity of their behavior. Here's one of the things I've noticed about kids with oppositional defiant disorder, though. They don't look like they have oppositional defiant disorder every second of every waking hour. They look like they have oppositional defiant disorder sometimes, which is why I sometimes refer to them as having what we might call part-time oppositional defiant disorder. When do they look like they have oppositional defiant disorder? When the demands being placed upon them by the environment include demands for flexibility and adaptability, frustration tolerance, and problem solving. I find that the oppositional defiant kids don't look oppositional defiant unless those demands are being placed upon them.
Okay, Jordan, do you buy that? Is this not a question of dominance?
No, I don't buy it. I mean, but I actually don't also think it's something to argue about. I mean, we know if you look at childhood temperament, for example, that there's a temperamental dimension called constraint. And constraint develops into agreeableness and conscientiousness in adulthood. And kids that are aggressive tend to be lower in agreeableness and lower in conscientiousness. And what that means is they're less empathic by trait temperament, and they have a more difficult time following rules. Now, it's possible that there's a cognitive element to that, but at the moment that hasn't been proved. So, for example, you can have high IQ kids that have oppositional defiant disorder. What we've found with regards to conscientiousness, which is rule following, is that it's actually based in much lower levels of the nervous system. Aggression is a natural response. It's grounded in hypothalamic circuits, actually, and the hypothalamus is a very, very old brain area. Any animal that's aggressive has aggressive circuitry in the hypothalamus, and children definitely fall on a continuum with regards to aggressive behavior. Now, some kids aren't that aggressive, and they're a lot easier to socialize. Most kids, in fact, are like that. You know, they in peer groups, say if you put 2-year-olds together, there's a subset of them that will spontaneously fight. Most of them are boys. It's about 5% of them, and those kids are hard to discipline because they're challenging. And they often are explosive with regards to their negative emotions too. So they'll put up quite a struggle while they're being socialized.
All right, well, let's take a look at the exact symptoms that we're talking about here, because I'm sure parents would like to know. Here's what is outlined in the Center for Addiction and Mental Health: excessive arguing with adults, active defiance and refusal to comply with adult requests and rules, repeated attempts to annoy or upset people, often blaming others for their own mistakes or behavior, often acting touchy or easily annoyed by others, frequent loss of temper, frequent feelings of anger and resentment, and often acting spiteful or vindictive. Okay, Jordan, how
well, those
many?
Those are reflections of two fundamental temperament dimensions.
Right.
One is negative emotionality. So people experience positive and negative emotions to different degrees. And there are plenty of people who have very powerful negative emotions, and that tends to make them irritable and easily frustrated. And when they get irritable and easily frustrated, they're likely to act out more. And then if you combine that with low agreeableness, because agreeableness is the compassion dimension, they're not so empathic. So they're quite self-centered, plus they're easily upset. Now, that would put them in the category of kids who are likely to show outbursts. And now sometimes the kid can be neurologically damaged too. You know, that's a different subset of problems. So a kid that might be anoxic at birth or suffered head trauma of one form or another can often be aggressive.
Okay.
But most of the things we'd be talking about are temperamental variations that are often complicated by ineffective disciplinary strategies.
All right. Ross, how many of the, if you can remember there back a minute, the symptoms, how many of those symptoms does a child have to display to be diagnosed with ODD?
You know, because I'm not a very diagnostically oriented mental health professional, I don't actually have those things memorized, but I think you need to have 5 out of the 8. But I think that the important thing to know is that the core feature of oppositional defiant disorder is noncompliance. A kid who is at a greater frequency and at a greater intensity than other kids, having difficulty complying with adult rules and requests. So quite frankly, I think a lot of the diagnostic criteria that you just put up on the screen have a lot to do with adult judgments about what the behavior is about. I think spitefulness and vindictiveness is an adult judgment. The core feature is noncompliance, and in kids who are extreme in their reaction to adults issuing commands and them having difficulty following those commands, these are kids who do things that are at a more extreme end of the spectrum. These aren't just kids who are crying and pouting and sulking. These are kids who are hitting and spitting and throwing and destroying and doing all kinds of things that we adults aren't too keen on.
Okay, Ross, what causes that behavior then?
Well, as I've said, my belief is that these are kids who are lacking crucial cognitive skills, especially in the domains of flexibility, adaptability, frustration tolerance, and problem solving. And there are lots of kids who are ultimately diagnosed with oppositional defiant disorder who had difficult temperaments from the word go, but there are also lots of kids who had relatively easy temperaments who ultimately end up meeting diagnostic criteria for oppositional defiant disorder. And some of these kids are kids who were easy in the beginning, but as the world began requiring more communication skills, these are kids who fell off the apple cart because their communication skills didn't develop so well. As the world demanded increasing impulse control and attention span, these are kids who fell off the apple cart because they were lacking those skills. As the world demanded increasingly gray thinking, increasing flexibility, these are kids who fell off the apple cart because those were skills that they were lacking. I find that there's various points in development, depending on what skills are being demanded and what skills we expect to develop at each point in development, that kids end up looking, non-compliant, and could end up being diagnosed with oppositional defiant disorder.
Okay, Ross, it sounds like what you're saying is that there could be other reasons for this behavior and that the ODD is the consequence of perhaps some learning difficulties or other issues.
Well, that is precisely the point, and that is that in my research and in a lot of other people's research, kids who meet diagnostic criteria for oppositional defiant disorder almost always meet diagnostic criteria for some other psychiatric disorder. Now, what does that tell us? Well, many kids with oppositional defiant disorder, a majority in fact, also meet diagnostic criteria for attention deficit hyperactivity disorder. What skills do kids with attention deficit hyperactivity disorder lack? Attention span, self-regulation, impulse control, organization, planning, problem solving. Is it oppositional behavior that causes kids to lack those skills? Or is it the lack of those skills that contributes to the development of oppositional defiant disorder? I personally think it's the latter case. Kids with oppositional defiant disorder also have very high rates of mood disorders, irritability, cranky, grouchy, grumpy, anxious, nervous, worried, scared. There's a very high rate of communication skill disorders in kids who are diagnosed with oppositional defiant disorder. Very high rates of kids who are lacking crucial social skills in kids who go on to be diagnosed with oppositional defiant disorder. I find that when we identify what skills the kid is lacking, we have a much more compassionate, accurate, productive view of what's really getting in the kid's way, and that tends to be the impetus for the type of intervention that I think works best with these kids.
Okay, let's get to that in a minute, Ross, but very quickly, so you're saying there's a genetic link here then, is that right?
Nope.
No?
I don't think that a genetic link has been proven. I don't think that there's a reason to necessarily tie genetics to lagging skills. I think that that is a link that has not quite been made, especially in the realm of the type of lagging skills we're talking about here. So I think that's a premature assessment. Plus, in graduate school, I was taught that everything's 100% nature and 100% nurture. So I always hesitate to ascribe anything completely to genetics or completely to environment. I find it's always both.
All right. Jordan, I'd like you to weigh in on this. What role do you think parenting plays in this behavior?
Well, I think often when you have kids that are misbehaving badly, there's a mismatch between the parents and the child. So some children are more difficult to control. Now, you could break the oppositional defiant disorder antisocial behavior into two components, and one would be the intrinsic motivation. A kid has to have a reason for having the temper tantrums, and that's partly why I brought up dominance to begin with, because kids like to be in control, and they often don't like to comply, and that's because they have impulses to do one thing or another, and the parent is trying to push them in a different direction. They want something, for example, like a toy. The parent is trying to impose a longer-term viewpoint on the child. The child's not very happy with that. Now that can be complicated, of course, by the lack of control mechanisms that Ross was talking about. But you have kids that are cognitively impaired in a variety of ways who don't show oppositional defiant disorder because they have rather placid temperaments.
That's true.
Now, the kids like order. You know, order is useful for kids. And kids who don't sleep well or don't have regular sleep times and kids who don't eat regularly are much more likely to show these sorts of outbursts. And the reason for that is that it's very difficult for the child to remain controlled if he's overtired or if he's hungry. And so if the environment that the child's raised in is chaotic in terms of its temporal structure, then this, and this is true for normal children, outbursts are much more likely. And the other thing you can do if you want your child to continue outbursts is erratic disciplinary strategies. So if a child's very persistent about something, and they persist and they persist and they persist and they persist, and you keep saying no, and then you say yes, what you've taught the child is if they're persistent enough, you'll break. And if you do that erratically, so let's say the child pushes you 3 times and then you break, and then the next time the child pushes you 10 times before you break, and the next time it's 7, then the child learns that different levels of persistence across situations are likely to bring about the results that he or she wants. And kids that are tough-minded, antisocial or oppositional, can be unbelievably persistent.
Okay, who are these kids? Who tends to have ODD?
Well, I look at it from a temperamental perspective. You know, there's variation in things like agreeableness. So,
is there a gender divide, though?
Yes, boys are more likely to be, all the way through, males are more likely to be aggressive than females. So the thing that you get with females more frequently is that females are frequently higher in sensitivity to negative emotion. So you can get a female child who's irritable, but that's for different reasons than the straightforward oppositional. Opposition is something like a battle of wills. If you have an aggressive child, the aggressive child will try to take control over the situation and maintain that. And, you know, aggression isn't all a bad thing. You know, I mean, people who are more aggressive are able to stand up for themselves, and sometimes if they're well socialized, they're able to stand up for things they believe in too. But tough kids can be very difficult to socialize. So if you have a nervous parent who's easily upset, or somebody who's very, if you have a couple where there's no concord with regards to what the disciplinary strategies might be, you're much more likely to have a child that's erratic.
Okay, what are the treatments then, Jordan, for ODD? If you have a child that's been diagnosed, what do you do?
No, it depends on the age, eh? Like prevention beats cure. And if you have a child that's difficult to discipline, then the first thing I would always recommend is to stabilize the wake times and the feeding schedules. That's going to make a big difference. So, you know, in my view, it's good to have children go to bed relatively early. Let's say if we're talking about someone who's 3 years old or so, because that's when you could start seeing this sort of behavior emerge. They should be asleep somewhere in the neighborhood of 8 or 9. And there's a bunch of reasons, and that should be stable. It's partly because kids need a lot of sleep to develop properly. It's also because the parents need time to themselves in order to have, you know, maintain their relationship, but also they need time away from the child so that they can do the things they need to do and so that they can relax and, you know, face the next day. And then with regards to meal times, you know, I mean, I think the standard mealtime arrangement is a good one. A lot of socialization takes place around meal times because meal times involve sharing and rule following and the subordination of intrinsic motivations to a broader rule governed structure. And so if you can get those under control, well, that's a good start. So that's a good place to begin.
Okay, Ross, how would you treat ODD?
Well, as you now know, I probably wouldn't call it ODD in the first place, but
These behaviors,
I think
then.
I think that what we have here is sort of the classic debate that goes on not only among mental health professionals, but in society about what's challenging behavior really about. And we have two very distinct perspectives being presented here. I think that Dr. Peterson's perspective often leads adults to think that the main goal of intervention is to give a kid the incentive to do well and to sometimes teach the kid who's the boss, and often leads to battles of will, with the adult trying to demonstrate to the kid that the adult will is going to win out. That's not what I spend most of my time teaching people how to do. I spend all of my time teaching adults how to collaborate with kids on solving the problems that are reliably and predictably precipitating or setting in motion challenging episodes between adult and child. Because once again, these episodes are not happening every second of every waking hour with a kid. They're happening in response to specific, what I call unsolved problems, specific disagreements. And the goal of intervention, in my opinion, is to teach adults and kids how to solve those problems collaboratively. This is not a matter of power. This is not a matter of will. This is not a matter of dominance. This is a matter of two people putting their heads together to try to solve a problem in a way that works for both of them.
All right,
and in so doing, so doing, teaching the kid many of the skills that he's lacking. And not only is the kid picking up on new skills when he's learning how and participating in collaborative problem solving, the adults are picking up some new skills as well.
All right, Ross, can you give me an example, just a quick example of a behavior that a child might exhibit at home and what the parent would do about that?
Well, let's say that a kid is, let me think of a common one. Let's say that a kid is refusing to come in for dinner while in the midst of playing a video game. One approach to that, one that's much more oriented toward dominance and control and will, would be to tell the kid that if he doesn't come in for dinner right now and turn the game off right now, he's going to get a timeout or some other form of punishment or lose a reward that he thought he had coming to him. My experience is that in the case of the kids who we're talking about right now, that's actually going to set in motion worse behavior. But if we're doing collaborative problem solving, then one of the things we've already done is noticed that coming in for dinner while in the midst of playing a video game commonly sets off challenging episodes in our household, which means we don't have to intervene in the heat of the moment. We can intervene proactively because this is a highly predictable, what I call unsolved problem. And if we're doing that, then we're going to approach the kid way before it's time to come in for dinner from playing a video game and say to him, I've noticed that when I call you in for dinner from playing the video game, that seems to cause a lot of difficulties between us. What's up? And what the adult is now doing is gathering information from the kid so as to get the clearest possible understanding of why this is a significant problem. Maybe the kid is in the middle of a game. Maybe the kid feels like if he pauses the game, he'll lose the game. This was actually happening in my office just yesterday afternoon, this very discussion. The goal is to get the kid's concern or perspective entered into consideration. The next goal, the next ingredient, is to get the adult's concern or perspective entered into consideration. Maybe the adult's concern or perspective is that if we wait too long to come in for dinner, dinner will get cold.
Okay.
We now have two concerns on the table. We have only one ingredient left because we are now at the precipice of solving this problem in a way that works for both of us. And that's brainstorming. Brainstorming solutions that will address both concerns, the concerns of both parties, so as to solve this problem in a way that works for both of them. It should be obvious that that's a very different way of going about doing things than simply telling a kid what he's got to do, and if he doesn't follow your directions, administering a punishment.
Okay, well, Jordan, no matter how you decide to go about solving these problems with your kids, this sounds like life must be difficult for the parents. What do you hear from parents who have children?
Yeah, well, life is difficult for them. And these collaborative problem-solving approaches are great once the kid's old enough to enter into them. I mean, it's perfectly reasonable to use negotiation to solve a problem. You know, and Ross outlined the basic steps of negotiation. You know, don't intervene at the moment of crisis. Try to identify what the problem is in the viewpoints and see if you can come to a mutually agreeable solution. That's perfectly reasonable mode of conflict resolution. The interventions I was talking about were really aimed at younger kids, you know, because you see an explosion of temper tantrums often at 2 and then progressing into 3. And by the time it starts to progress into 3, then it starts to get often out of the range of normative behavior. It's harder to enter into collaborative problem solving with small children because they don't have the verbal capacity or the insight often to figure out exactly what it is that's motivating. And so control over the environment in those circumstances seems to me to be a good initial approach. So.
Okay, Jordan, what happens if these children are not diagnosed and treated? What are the consequences?
Well, the evidence for antisocial behavior, so that would be, I suppose, the extremer forms of oppositional defiant behavior, is that if it's not brought under control by the age of 4, a substantial proportion of the children maintain their high levels of aggressive behavior. So they maintain them through an elementary school, they maintain them into junior high, when a lot of other kids often start to become aggressive as well. There's a spike around 15 for boys in particular. And then the kids that were aggressive continue being aggressive generally long after the other ones quit. Okay. So the issue is it's fairly stable behavior, and that can be a real problem. It alienates the kids often too, because it's hard for kids that are oppositional and defiant to make friends because they're not good at engaging in collaborative play.
Right. So. Okay. All right, Ross. Jordan says it has to be fixed by the age of 4. What happens if it's not? What can you do later? Is it too late?
Well, I've always said it's never too late to have a happy childhood. But I think that it's an interesting thing about the data. The big question is this, if it's not quote unquote fixed by the time a kid is 4, are the data telling us that at 4 years old the kid is destined to a horrible outcome? Or are those data telling us something very different? Are those data really telling us that we as a society have a very long way to go as it relates to understanding why kids act this way, and a very long way to go as it relates to intervening in ways that actually work? It's entirely possible that the reason things tend to stay stably bad and sometimes get worse is because of how misunderstood these kids are and how we continually apply treatments that haven't been terribly effective. So I'm not sure if this is a kid's destiny. In fact, I'm quite certain that it's not. Collaborative problem solving has been applied not only in kids younger than 4, but also in juvenile detention settings, where it's known for being a rather effective model of intervention. So I think it's a very interesting question. I think a great deal of why these kids don't get better is because they're very misunderstood and poorly treated.
All right, Ross, what would be your final advice to parents who might be concerned about this? What would you say to them?
Well, I think that the biggest part of helping reduce conflict in a family is to understand why the conflict is happening in the first place. And as you've now heard, I believe that conflict occurs because kids are having difficulty complying, and I think that kids are having difficulty complying because of lagging skills in some very crucial skill areas. So I think that you got to have the right lenses on if you're going to understand and help a challenging kid. If you've got lenses on that are counterproductive, well, that's going to lead to counterproductive outcomes. And then the only other comment that I would have is, I find that the ingredients of collaborative problem solving are crucial at every point throughout development. Even in a young infant who isn't able to participate in the form of collaborative problem solving that I described because they aren't able to participate in linguistic give and take, still is letting us know, probably by crying, that they have needs that aren't being met, discomfort, scared, anxious, and it is incumbent upon us adults to figure out what those things are, even when a kid lacks the communication skills to let us know what these are, and be responsive to the kid's needs.
Okay.
And I find that that's the ingredients, whether the kid is 1 day old or 87 years old.
Thank you very much, Ross. Jordan, we have about 30 seconds. What would you say to parents?
I would say start early, make minimum rules, enforce them, and don't let your kids do anything that makes you dislike them. Because if you help them adapt to your environment, assuming it's reasonably healthy, then you're going to help them learn how to adapt to the real world.
Okay,
So
which I guess is our goal in life,
that's
isn't
the
it?
goal.
Thank you very much, Jordan, and thank you, Ross. My guests have been Jordan Peterson and Ross Green. You can find more information on ODD, including articles, research, links, and blogs, on our site at tvoparents.com. Just click on Your Voice and this show topic. We've also posted upcoming shows, so if you have a question for one of them, send it in. We'll ask the experts. And if you have a show idea, send that in too. We want to cover the issues that affect you. Your Voice airs every Sunday night at 6 p.m. on TVO, and we are online anytime at tvoparents.com. I'm Cheryl Jackson. Thanks for watching.